How many times a month should you get a headache?
No, it should be fairly infrequent. And most people shouldn't even have a headache on a monthly basis. But unfortunately, there are many Americans who get headaches quite often, and there are a few, about 45 million of us, who suffer about 15 or more each month.
Wow.
Yeah.
That's a lot. We're
Absolutely.
talking about chronic headaches. What are chronic headaches?
Well, that's exactly that type of person, one of those 45 million who suffers from headaches very frequently, and these things don't respond very easily to the normal conservative measures that we recommend, such as getting adequate sleep, maintaining a regular sleep-wake cycle, rest, eating appropriately, avoiding caffeine, avoiding alcohol, avoiding tobacco.
Right.
All these are factors that kind of add to the amount of stress in your life, which can be a significant trigger for headaches.
Now, what is the difference? What is a migraine?
I see. Migraine headaches are a specific type of headache that have something called an aura associated with it. So these are people who suffer headaches quite frequently, and they know when a headache is coming on. They may have a certain visual cue, they may smell a certain something, so they have a cue that says a headache is coming on, and it's typical and it's recurrent for them.
Now, you mentioned caffeine earlier.
That's right.
Can alcohol or caffeine affect someone to increase their chances of having a headache?
Yes, absolutely, absolutely. Both caffeine and alcohol can. And what alcohol does is it dehydrates you, and that makes you more prone to headache. Staying well hydrated actually helps to avoid them. And caffeine can affect your sleep-wake cycle, and also it can cause some blood vessels to constrict and your heart rate to come up. So taking a regular amount of caffeine every day may be okay, one or two cups of coffee. But if you stray from your normal or stray from your average, these are all things that make you much more prone to suffering those severe headaches.
I heard a lot of people who drink red wine are prone to getting headaches.
That's right. That's not really alcohol in the red wine. There's another chemical in the red wine that makes you prone to get headaches, and these are people who know that they're going to get it. They'll start with one glass of red wine, and either that night itself they'll have a severe headache, and this is different from the hangover headache that they get the next morning.
Best treatment?
Best treatment, stay well hydrated, exercise, regular sleep and wake cycles, and avoid caffeine, alcohol, and tobacco.
All right, thank you so much for joining us this morning. And remember, Dr. Vijay is here Sunday to answer all of your medical questions. So if you have a topic